Let's talk about occipital neuralgia. So occipital neuralgia is a type of headache that is thought to be due to irritation of an occipital nerve. Therefore, the pain arises along one of the distributions. For example, the third occipital nerve, it arises from C3 and innervates at the base of the head medially. The greater occipital nerve arises from C2 and innervates most of the posterior head, especially medially. And laterally, you'll have the distribution of the lesser occipital nerve, and that arises from C2 and C3. The pain typically has spontaneous onset, although trauma has been noted to be a risk factor. So here you can see an illustration of the distributions of the nerve. So the third occipital nerve innervating more the base of the head and some of the neck medially. The greater occipital nerve innervating most of the posterior scalp, and the lesser occipital nerve innervating laterally. For clinical features, the pain will have a sudden onset along the distribution of one of the aforementioned nerves. There will be severe pain that presents in paroxysmal attacks lasting from a few seconds to a few minutes. The pain can be unilateral or bilateral, although unilateral is more common. And the quality of the pain is shooting, stabbing, or sharp. One thing that is required is that stimulation of the hair or scalp can cause allodynia or dysesthesia. There can also be tenderness or trigger points along the distribution of C2 or the emergence of the greater occipital nerve. The pain must improve with local nerve block to be diagnostic. For evaluation, an MRI brain and cervical spine is done, and this is because there are underlying lesions that can cause pain that mimic occipital neuralgia, and this can include tumors, vascular compression, multiple myeloma, demyelinating disease, among others. For treatment, occipital nerve block with lidocaine and bupivacaine is the first-line treatment, and this is diagnostic and therapeutic. The vast majority of people do respond to occipital nerve block, and a few months down the road, if the pain returns, then a repeat procedure may be indicated. Oral medications have also been tried for people especially who are averse to nerve block, and these medications can include gabapentin and tricyclic antidepressants, although the effects have been variable. For prognosis, most patients tend to respond well to occipital nerve block and luckily do not need adjunctive oral medications.